Postnatal growth of mandible went through the process of remodeling and displacement. Remodeling includes resorption and deposition of bone. Start with the mechanism of the postnatal growth. To understand the mandibular growth, one must distinguish between two simultaneous processes: primary displacement and secondary remodeling. In primary displacement, mandible pushed downward and forward as the soft tissue like tongue and muscles expand and the cranial base grows. And secondary remodeling, bone grows into the space created by displacement, primarily at the condyle and the posterior border of ramus. Site specific growth patterns. First is ramus. So ramus is the most active remodeling site for increasing the length of the mandibular body. Bone deposition on the posterior border of the mandible and bone resorption on the anterior border of the mandible. So result in entire ramus moves posteriorly, make space for the eruption of first, second and third molar. Condylar process. The growth of condylar process occurs superior and posterior direction. So condyle cartilage undergoes endochondral ossification. This maintains the height of the ramus and keeps the mandible in the contact with temporomandibular joint as the jaw is displaced downward. So the condyle is a major growth site. Earlier in the genetic theory, the cartilage in the condyle grows by its own genetic command, physically pushing the mandible downward and away from the skull. In modern functional matrix theory, as the functional spaces like the airway and the oral cavity and the functional units like muscles of mastication, tongue, glands expand, they physically displace the mandible downward and forward, and this displacement creates a gap at the temporomandibular joint. The condyle cartilage then grows upward and backward to fill the gap and maintain the integrity of the joint. Then coronoid process, bone deposition on the lingual surface and bone resorption on the labial surface. Result, as the V moves upward, the two teeth move further apart, increasing the width between the left and right coronoid process to accommodate the widening skull. Then mandibular body. Body height increase due to the deposition along the inferior border. Then alveolar process, deposition of the bone at the alveolar crest as teeth erupt. And in lingual tuberosity, it acts as the boundary between the ramus and the body. It moves posteriorly through the deposition on the posterior surface, further lengthening the arch. Then angle of the mandible. So lingually, there is a resorption on the posterior inferior aspects and deposition on the anterior superior aspects. And buccally, there is a deposition on the posterior superior aspects and resorption on the anterior superior aspects. These results in the flaring of the angle of mandible. The area just below the lower incisal undergo resorption and the tip of the chin undergo deposition. The combination creates the distinctive chin profile.